Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about positional peripheral neuropathy. Let me give you a story first. The idea is when I found out that I had peripheral neuropathy, I found that driving, when my hands were up, that they would start to get numbness and tingling in my hands. I found that if I put my arm around my wife, that I get severe pain in my shoulder and my arm and my hand, and it was always positional. If I would move it back down, it would go away. And the interesting thing I started wondering is, okay, is positional peripheral neuropathy a real thing? Is there a situation where in certain positions, turning my head a certain way, sitting a certain way, could cause peripheral neuropathy? Now, the answer to that is, of course, yes. There are positional reasons for peripheral neuropathy, and I'm going to talk to you about three. Number one, the most common is that there's something going on in the spine that actually causes pressure in certain positions, will cause extra pressure in those nerves. The most common presentation of this is positional neuritic pedal neuropathy that happens down in the spine at the lower spine area in the L5-S1, so right near, basically almost to the base of the spine area. And what happens is that positional will cause symptoms usually on one side due to pressure. Number two, back issues can cause peripheral neuropathy, right? And what happens is the nerve gets stretched in the spinal cord. The best way to test for that is we have someone lay completely flat and we lift their leg up. As you lift your leg up, it stretches that nerve. It causes symptoms. So pressure from the spine can cause it. Stretching of the nerves can cause it. And the third one is the one that we commonly don't think about. And that's where the nerve itself is injured in some way. This can be toxic type neuropathy. This can be an inflammatory type neuropathy. This can be a diabetic neuropathy where the large nerve fibers, either the axon or the myelin sheath area, the most common areas, are damaged in such a way that in certain positions, the nerve gets insufficient blood flow or it gets insufficient nutrition to allow it to function. So in those positions, you'll get increased symptoms because the nerve is already malfunctioning. It's just making it harder for it to function and it makes it worse. So positional neuropathy is a real thing. And because of that, one of the things that we're working on very carefully is to find ways that we can actually alleviate these positional neuropathies. The best way is to decrease the toxic neuropathy, decrease the inflammatory neuropathy, improve the health of the system, improve the blood flow. All of these will improve peripheral neuropathy, even positional peripheral neuropathy. And those are very, very valuable in all cases of peripheral neuropathy, because as you improve the health of the nerve, all these pressure spots, these compression spots, these toxic situations are alleviated. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget Day 333. Positional peripheral neuropathy is a real thing that can be treated, can be alleviated. If you want additional information, join us for the weekly webinar at the neuropathywebinar.com. Thank you. We'll talk to you later.